Hello everyone, today I am going to talk about wound care, not scars. So I have two wounds from this operation and they're the things that I'm going to address. Now I may go over my bag as well, but that'll just be little hit things. I'd have to do a whole video on just the bag itself because it is a whole different beast and you do have to live with it forever. So, wounds. Now, when you're in hospital, you don't have to worry about them as much, but it is a good time to get into some really good habits. So, imagine you have just had your operation and you wake up, you'll probably already have a bandage over the front scar. They may take it off to wash you to get rid of the iodine from your skin or whatever it is that they've been using recently, but mine was iodine. It's kind of an orangey colour. Now get that off your skin as soon as possible because it can have a bad reaction sometimes if left for too long. Usually the nurses will be there to make sure that you change your dressings. Watch how they do it and, learn from them, ask them questions. Now, when I did it, I usually had the dressing under, because my bag and dressing overlapped. I would put the bag under and the dressing over, or the dressing under and the bag over. So I preferred having the dressing under and then the bag stuck on top, because if the bag leaked, it wouldn't go straight to where the wound was. It would have to try and get through the dressing. Hopefully I'd have noticed by then. Also, the dressings are usually waterproof, so when you wash yourself you'll be okay. So the wound at the front, you need to make sure that you're watching out for bleeding. So if the dressing looks like there's a lot of blood on it, and if it's spreading and it's fresh, then just ask a nurse and see if they may want to change it or if they want to check the scar out itself. But hopefully everything is going okay, and you'll keep the same dressing on for maybe a day or two, and then they'll switch it, and then soon after that you probably go home. Now, the one at the back has no dressings, so the one between my bum cheeks has no dressings. It had a pad that they put underneath me that I sat on. Well, when I lay down, it was under my bum, because it will weep and it does bleed a bit, and it is a bit pissed off by my language, but it is. Your body will, you'll be a bit swollen, you'll be a bit sore. When it comes to coughing and things like that, what I would suggest is get a towel or get a sheet and get a nurse to wrap it up for you, even a pillow, and hold it over your stomach. If you're going to sneeze, you're going to cough, hold it over your stomach and sneeze, and it will really prevent the amount of pain that you will probably go through when you sneeze. Because sneezing can be, also it's a mental thing with sneezing. You think you're going to explode, you think you're going to burst everything. So having that hold over yourself, you're holding yourself together, it does help with the pain, and mentally it does make you feel like you're not going to rip open. Not many people do, just be careful. So with the wound at the back, what I did is they bring you a bowl. If I can't get to the shower, they'll bring you a hot bowl of water with soap and wet, they'll give you a lot of wipes. They're dry, and then you put them in the bowl to create wet wipes. Wash all of you, wash every single part of you, make sure that you're nice and clean as best you can by your bedside if you can't walk to the bathroom. So lie down and sit in the chair next to your bed, wash your upper body, wash your lower body. Do it in sections if you need to, if it makes you feel like section 1's done, section 2, section 3, section 4, section 5. Then focus on your wounds. So the wound underneath, I stood up and I reached under and I reached back, and I know it's scary, and I know that you're not going to want to go under there and reach, but you're going to have to do it. This thing has now become a part of you, and you need to look after it. So you need to get under there and you need to clean the wound underneath, and then afterwards you need to dry yourself. Now, I wouldn't recommend using a towel on the wound underneath. I would use a towel all around the area, so your bum, your lower back and everything up to it, and then I would pat dry with lots and lots of dry wipes. Go through as many as you need, because it is quite sore and you don't really want to pull a towel over that because it's quite rough, so pat dry it. And then, when you've done yourself, get back into bed, and you'll be okay for the next day. So when you're coming to leave hospital, ask the nurses for more dressings. If you have your dressings removed off the front and you don't need them anymore, say, you know, could I have a dressing just in case it leaks? And they will give you one, or they will give you two. If you're leaving and you have dressings on, they will give you 3 or 4. They will help you, and they, you know, the nurses aren't going to keep them and go, no, these are for patients. You are a patient, and they want to see that you're getting the best help possible. And dressings aren't cheap. Like a big one from Boots that's about this big and it's waterproof is about £2 for one. So, you know, it's not cheap. So ask for them and they will give them to you. You can even take some wipes and if you're lucky, maybe some tape. Now, you've got your extra dressings and how I would use those on your front scar when you're home. So waterproof dressings, I suggest you put them on at night. So I would, at the end of the day, after you've got home from the hospital, it's your first night, get unpacked, get relaxed, you know, hopefully you have someone there to help you. At night I would put your pillows, you know, onto your bed to make it so that you've sat up, lie down so you can oversee your stomach, and I would change your dressing. And I would wash the area with wet, not just baby wipes, you know, these just normal everyday baby wipes, with them, but also with a bit of water and a bit of soap, dry it off. And I highly recommend using these. They're antiseptic wipes. You only need to use one, and you just need to wipe it up and down the area. You just know after using one of these that obviously there's no bacteria left, you know, it's all been killed because these are antiseptic wipes. I wouldn't overuse these. I'd use one and then I would dry the wound and then I would put your dressing on. So you've cleaned it, you've dried it, then you've made sure that there's no bacteria left, then you're going to dry it again, cover it up. So I would use waterproof ones at night if you have a bag and it may leak, and if it leaks onto your dressing you don't want it to be a dry cotton type dressing that has breathing because it will soak up the feces, so you don't want that. So also the reason why I'd say put one of those on at night is you wake up in the morning and then you go for your shower. So you go for your shower and that dressing, you know, obviously waterproof, good for the night, waterproof, good for the morning as you do your shower. Then I would suggest you take that off after your shower and have a look at your scar. To be honest, if it really looks quite good and your dressing is fine, leave it. But with me, because it was weeping, I wanted to get it off, mop the weeping up and then cover it up again. I also suggest during the day using a drier, breathable dressing. So, sorry, these are adhesive wound care patches and, well, dressings. You know, they're very, very good and you can cut them to shape. So if it's too big, or even if you have only a small area that's weeping with a bit of blood or some fluid and you just want to cover that section up, you can cut these to size and you can use tape to make sure it's proper medical tape. Make sure you keep it in its box. I mean, mine's got a bit of other stuff stuck to it, but try and keep it in its box so you don't get other bits of bacteria and, you know, things, because it will stick to it. So be careful with that. Now, after you've had your shower and you know you just use normal soap. This means the back wound. Obviously, this is, you know, national code. It's not. Okay, so wash it with normal soap around the back and make sure that you clean it as good as possible. I would take off your shower head. Do not have a shower. I mean, do not have a bath. Your nurses will probably tell you the same thing. Ask them if you have any questions. But do not have a bath because you're just churning around the same bacteria. Have a shower. It's a lot more hygienic. So, you know, get the shower head and get under there and make sure that all the soap is gone and you clean it as best as possible. And, you know, keep the dressing on the front until that wound is sealed. So you've had your shower, you've come out to dry yourself off. Now I would towel dry everywhere, but the same principles go for when you're at hospital. I would not wipe dry with a towel the wound at the back, your scar at the back, because it will be sore. Your towel may not be as, you know, clean as possible. You also have stitches there. Some may be stuck out. You don't want them to get caught and you don't want to pull on them. So what I suggest is use a hairdryer on cold. That's very important. Make sure it is on cold, and use that to dry the undersection around there. It makes so much difference. I thought it sped up everything, and it didn't hurt. It didn't hurt because I didn't have to touch it. It just did it naturally. It took some time. Excuse me. It took some time, but I think it's a top tip because it's very much less painful, and you're not manhandling it. Also, a good tip: do not touch your wounds with your hands unless you have just cleaned them. If you have touched it's irritating you and you want to move something, there's a hair in the way, and you touch it, go and wash your hands, or have some gel stuff that you can rub onto your hands before you touch yourself. Get into a habit of making sure you wash your hands quite a lot. They will become dry, so you might want to get some lotion for those, but do not just touch it with your hands. You don't know what you've grabbed, you won't remember, and you may get yourself infection that way. So we're washing the back every day and we're drying it off, and the front is coming along fine. Now, if you're taking the dressing off and your scar has become sealed and it's not weeping, then your nurses will suggest, and if you have any questions, obviously you ring them and ask them, but they will suggest that you keep it out, keep it aired. And at that point, that's brilliant. Start showering and treating it normally. If you do get some weeping, if you do get some fluid, I would ring the nurse. But if it's just a small section, I would, cut and use tape and just cover that section up. Don't cover up the whole thing. Cover up just that area so that the rest can heal, and doesn't get soggy, and the rest can heal while the other bit is just a little bit behind. So always ask the nurses if you have any issues. Now, if you believe that you're going to have an infection, call a nurse. If you think you already have an infection, stop watching my video and call a nurse. However, some of the things you can do to look out for it is if your scar around it is very red, you may have an infection. Another tip is you get this part of your finger, you put it against your skin there, and then you put it there on your scar, and you'll feel if this is hotter than this by quite a lot, you've probably got infection and you should definitely ring a nurse. And it's just something that you can get someone else to do and you to do to keep an eye on if there's an infection. And obviously the redness going around your scar as well, and any weepage could be, but weepage and fluid is usually just there is fluid builds up because of the trauma of the area. So the things that I've used, Fiddleworth give me complimentary wipes. These wipes are amazing. Normal baby wipes, antiseptic, medical tape, and boots adhesive plasters and waterproof plasters, which I don't have any left. Also, I know it's not real wound care, but it's just good for you. Just multivitamins. These from Asda, they're less than £1. Get your multivitamins in to keep your immune system up. So I'm going to show you a picture of my scar from a week after my operation. Now, I'm sorry if it's a bit grim, but you'll see around the edges, so my belly button's there, around the edges, it's kind of yellowish. That's just bruising, and that's a bit tender, but it's okay. So don't worry too much about that. At the top, you can see the belly button. This is one of the hardest areas to make sure that it's healed, and you would keep an eye on that because you move a lot, you crunch over when you sit up, and that is going to not only hurt, but it just takes a while. And further down, you can see that I've had some redness. Now that redness became a little, like the skin came off. I think it was a reaction to some iodine that was still on there, and it came away, and that's why it's purple a bit now. But those are the areas that weeped, and I just covered those two separate areas up, and I clean them every single day, a couple of times. If you have a lot of weepage, do that. So I'm going to show you mine now. So hi, you're back. So here's my scar now. As you can see, it's quite red, but it looks okay. It's very thin. Most of you may have staples and it'll be removed. This is my old scar here, as you can see. Quite wide, a lot of staples with it. This is nice and thin. Here is where I had a bit of trouble with weepage, but I just covered this section, and I had a bit of trouble here with weepage. Now I've still got what I would call one of my stitches sticking out, so I'm just going to leave my body to deal with that as it wants. And I used to just cover this whole bit up, and then I would make sure I cleaned out my belly button every time I needed to change it. So this week I covered this and I left the rest and it healed, but when this week I only covered this. So I hope these tips helped. I hope that, you know, if you have going for an operation, you can watch this and you can think, oh, those are the things I can do. I would stock up on a lot of this equipment. I'm still using my baby wipes and my antiseptic wipes for round the back. I do not recommend you use the antiseptic wipes that much on the back because it can sting, mainly because you're wiping a lot, trying to keep it clean and things. The skin can get quite sensitive, so it's up to you if you want to use a moisturiser. I haven't, just because I do not want it to get too wet and moist in that area. I want it to stay dry, and that's something that I'm doing a lot. I'm, you know, going to the bathroom, patting it down dry, because obviously it's warm and I get sweaty. I would make sure that it is dry. So I hope these tips helped. I hope that I can answer any of your questions. If you have any, please put them in the comment section below, or email me, or get in touch with me. Everything will be in the bottom in the description. If you like the video, please like the video below. Share it if you know someone with Crohn's and you think this may be helpful for them, or ulcerative colitis, because I actually don't know which one I have. I'm going to do a video on which one I think I have. So guys, please get in touch with me. I will see you all in the next video.